but this is clearly a pretty rarefied atmosphere, and I think this is an early adopter group. So the challenge is trying to figure out how to document and codify how these successes have happened. So clearly there's a lot of wisdom in the slides that I can highlight some of the key points that emerge. When I first wrote them down, I was thinking there's lessons learned, and we borrowed some of the language from slides. Lessons learned for success, the important role of leadership, the integration of health literacy across systems, across departments, the use of evidence that was very widespread, both in terms of getting the conversation started, but also in terms of maintaining it. I was interested to hear this common theme that the policies coming out of the Joint Commission and other the healthcare reform also serve as a kind of impetus for organizations. So rather than hindering, they're really helping the conversation along. I realized after a bit, though, that those, I think, are really some of the attributes or the characteristics that characterize the success in the sustainability of these efforts and the maintenance of these efforts in the organizations that we've heard from today. There's also a lot of really good material that was at the more granular and kind of tactical level. We can think about struck some of the points that struck me, for example, were the creative strategies that different speakers introduced to make this not expensive. That, of course, is the concern of a lot of administrators. It's going to cost money, but rather than spending $4 million to train all of the nurses, and I think in the Carolinas they spent $6,000 creating some materials, and then they disseminated that. They spread it through the organization in a kind of on-the-job training kind of modality, using community partners, volunteers to do some of the user review, and the idea that there's the critical factor of having a team approach across departments. One of the strategies I think that Tom suggested for getting the physicians on the team is by really thinking of it as a multi-pronged approach. So you get the patients engaged and active, you get the support systems in place, and before long the doctors are doing it because it's just a matter of course. I think, of course, the culture and the leadership piece is important there as well. So I wonder, so what's missing here? So just a couple of observations. I kind of think of this as maybe I'm going to use a Socratic method here and start to introduce some questions since I have the bully pulpit for a minute. So one of the interesting points for me was that all but one of the speakers were from large health systems. I think I'm correct there for all this. Correct me if I'm wrong, but so I think for smaller organizations, the work that I'm doing is really with smaller rural organizations that might be more independent. How do we replicate some of these strategies in organizations like that? I think on the research and evaluation side, as I mentioned, evidence is clearly important, and there were a number of metrics that a lot of the speakers mentioned, but again, I would hope that might be kind of codified, and we think about, I'm an academic, so common, validated methods of study design and metrics for measurement that are appropriate, and here's where I sort of begin also to think about the conceptual frameworks. There was some variability in the speakers in the extent to which they were referenced conceptual or theoretical frameworks. Again, here's my academic hat on again. Bear with me. There are a number of theoretical approaches, conceptual approaches that are very consistent and allied with what we're doing here, and some of them were mentioned. So quality improvement, organizational behavior and change, diffusion of innovations. I think the extent to which we can integrate that line of thinking into the work that we're doing and make sure that we are capturing those kinds of conceptual approaches is important. And we're starting to do that. It's definitely entered into the conversation here. But that another one is the idea of dissemination and implementation. So again, this was introduced, and a lot of how do we roll this out? How do we make it available and try to make it easy for organizations to adopt this? And part of that is thinking about the nature of nature of evidence that is acceptable and appropriate for different kinds of audiences. In smaller organizations, they might not have the expertise or the wherewithal to do a randomized controlled trial, so there might be other kinds of more pragmatic kinds of study designs that are appropriate. And the organizations that I've worked with, they come up with them themselves, and I think many of the organizations here have done likewise. So the implementation sciences, I think, is an important part. That was what one of the key kind of frameworks I was trying to analyze the conversation by over the course of the day. And so some of the neat ideas that have come up there are, again, Rima mentioned it at the end, this notion of it's not so much adoption as adaption, identifying key ingredients of these interventions that can serve us and be that are the crucial ones, and then there are other elements of interventions that might be more adaptable. I think strategies for marketing and just distributing this knowledge, the tools, the resources is going to be a really important area to work on. So a number of you have introduced resources, different kinds of tools, have mentioned them, and I'm anxious now to go to your websites and look at them. I wonder, I think Dr. Noonan mentioned this, how can we share this information? How do we get our hands on standardized I think it's the hardest is patient education materials. I don't know who's going to be responsible for that work. It's a challenge in part because standardized materials aren't going to work for all populations. You need to be able to adapt them for some populations. But it seems to me that if we can identify some strategies for sharing the resources, starting with the resources that are available across the organizations in this room, I think that's a good starting point. What concerns me there as well is that we need to make sure that the materials that we're sharing really emphasize this system sensibility that we've been emphasizing over the course of today. So finally, I have a question to ask that I think perhaps the roundtable folks can consider tomorrow as well. Is I wonder which attributes matter when. Which attributes do we need to start with? Again, what impressed me over the course of these presentations was that a lot of the presentations included many of them, but there were 4, I counted, I wrote them, I sort of took a tally, I think like Dr. Isham, and the ones that got less check marks were inclusion of community partners, number 4, meet needs of populations with a range of health literacy, number 5, there was a 6 on that, provides easy access to health information, that's number 7, and then communicates clearly what health plans cover. So I think that those are some areas that we may want to see how we can get to that. But I think that suggests to me that the other ones, particularly the leadership, the training, are perhaps the ones, the foundational ones that we need to start with. I'll leave it at that.